Hello, everyone. I will be studying gastrointestinal health with you today using the block puzzle of Acuitii. If you haven't done so, head onto your app store and download the app Acuitii. When you get to your home page, which you see here, look for the purple block that says puzzle and just click on it. So you would have a list of categories that you can study, but today we would be focusing on gastrointestinal health. Let's get started. This is a timed game. So as we answer each question, the puzzle will be solved and we will see the image hidden behind the blocks. Let's go. How would you define diarrhea? Severe abdominal pain and cramping, difficulty passing stool. That sounds like constipation. Increased number of bowel movements with loose, watery stools. That's totally it. I would say that's it. And you're welcome to look at the explanation. Okay. So diarrhea is defined as frequent small watery stools. It is considered acute if it lasts less than 14 days and chronic if it's more than 30 days. Okay. And this can leave the individual dehydrated and depleted of electrolytes. So let's go to the next question. This is a common symptom of acid reflux disease. Heartburn, itching, hunger, obesity, drowsiness. What do you think? Heartburn, the feeling of chest burning, heartburn. Totally. Let's do that. Yes, we can look at the explanation. Yeah, the typical symptoms of acid reflux include vomiting, regurgitation, pyrosis. This term simply means heartburn, and sour or acidic taste in the mouth. Other uncommon symptoms of acid reflux include hoarseness, sore throat that continually returns, persistent cough, pneumonia, asthma, asthma-like symptoms, and chest pain not related to heart conditions are all symptoms of acid reflux. So you can always look at, refer to our citation at the bottom of the explanation. It's always going to be at the bottom of the explanation. So let's continue the block puzzle. Foods or beverages that may likely trigger acid reflux does not include this juice or food. So we're looking for foods or beverages that do not trigger acid reflux. Can coffee trigger acid reflux? Yes, it's caffeinated. Does orange do that? Yes, because of the ascorbic acid. Alcohol, totally. Chocolate, yes. The answer should be apple. Yep. We can look at the explanation too. Okay. So definitely take your time. I'm going to scroll down so you can read scroll up so you can read the explanation. Yeah, apple juice is not a known trigger. However, apple cider vinegar is a trigger, okay? It has acidic acid, so that would definitely trigger acid reflux, but apple juice is not. So let's go to the next question. What are common causes of peptic ulcer? Will sleeping cause it? Will bacteria? Water? I don't think water would cause peptic ulcer. What do you think? Antacids? Would not because that's supposed to counter acid. So totally, I think it's bacteria. And you can look at the explanation. Oh, we see our puzzle being solved. That's interesting. We're seeing the image being revealed as we proceed. Let's go back to the explanation. Okay. And you can see your citation as well. Okay, so let's go back to the next question. An antibiotic will most likely be useful for treating which of the following gastrointestinal tract conditions? What do you think? So I'll be very careful not to put my cursor on the answers so we all figure it out together. I'm sorry if I've been leading you on, but yeah, we have more questions to explore, so let's figure it out together. Um, so the answer is H. pylori. That's a bacteria. You can definitely look at the explanation. So Helicobacter pylori infection, which is also H. pylori, uh, is a bacteria that can infect the digestive tract. This condition could require triple or quadruple therapy that would include antibiotics, okay? Um, Antibiotics are not most likely used for the treatment of acid reflux, constipation, irritable bowel syndrome, or even hemorrhoids. But definitely when H. pylori is involved, antibiotics would be included in the therapy. So let's go to the next question. I'll be careful to keep my cursor outside so I'm not hovering over the answer this time. When should an adult see a medical doctor if the diarrhea won't go away after taking an anti-diarrheal? So after taking medications to treat diarrhea, when should you be seeking medical attention? When? If the diarrhea lasts for more than 2 days, if the diarrhea persists for more than 1 hour, after 24 hours of taking an anti-diarrheal medication, if the diarrhea does not improve after 2 doses of the anti-diarrheal, if the diarrhea continues for over 3 hours. Oh boy, I have only 10 seconds. Okay, I'm just going to pick if the diarrhea persists for more than an hour. I don't think it's right. Okay. Let's see, what's the explanation? If the diarrhea lasts for more than 2 days, you need medical attention. Why? Because there's a high risk for severe water and electrolyte depletion. Let's scroll up a little more. So yeah, so that we can all see that. If your diarrhea lasts for more than 2 days, on an anti-diarrheal like Imodium. Imodium is the brand name or trade name of loperamide. So after 2 days of persistent diarrhea, you really would need medical attention because of electrolyte depletion, which can lead to serious problems like heart-related problems, okay? So let's go to the next question. Okay, what is stomach ulcer? So this is supposed to be a super question. So I guess we really need to get this question right. You know why? Hmm. With the super question, we would get extra points. So we need to get this right. So what is stomach ulcer? Is it a bacterial infection in the stomach lining? Is it a type of cancer that affects the stomach, an open sore on the lining of the stomach or small intestine from stomach acid, a condition caused by water intake, a result of high fiber intake? So ulcer, that's definitely an injury in the stomach. So the answer would be an open sore on the lining of the stomach. Yay! We got we got 30 points. So prior to answering this question, we had 50 points. Now we got 30. Awesome. Let's go to the next question. Which of the following acid reflux drugs are prescription only? So some of these medications can be found over the counter. That means found without one of them should be, or all of them, but one are over the counter medications. That means they don't require a prescription. So which of the following acid reflux drugs are prescription only? Prilosec is a trade name for omeprazole. That is over the counter now, and is you can also get it by prescription, but it's over the counter. Nexium. So, oh, I have no more time left. Ooh. I'm running out of time. I would say which of the following acid drugs are prescription only? Pepsid is over the counter. So I didn't answer is Acifex. Oh, I didn't answer on time. That's why. So I chose the correct answer, but I didn't answer on time. Okay, let's continue. What are some lifestyle modifications to prevent acid reflux? So what can we do without pharmacotherapy to prevent acid reflux? Ooh, I already see our picture there. Our puzzleism. Oh, we only have one more block to deal with here. So this is the last question. Okay. Eating spicy foods and drinking alcohol in moderation. Wearing tight-fitting clothing. Consuming large meals and lying down immediately after eating. Taking over-the-counter antacids only. Sleeping with the head of the bed slightly elevated with foam wedges or blocks. I would say it's the first one. Uh, oh, we got it wrong. Persevere. Yes, let's see the explanation. I was running out of time and I figured I'll just pick something very quickly. So there are many lifestyle modifications that are non-pharmacological that can help prevent experiencing acid reflux, such as sleeping with the head of the bed slightly elevated with foam wedges or blocks. There are gastroesophageal reflux disease pillows. You can get these, I believe you can get these on Amazon. I'll make sure I put some links in the caption so you can check them out. But yes, there are some GERD pillows that you can buy online that would help, that you can put behind to help elevate your head. So to prevent the stomach acid from coming up through your esophagus, okay? So by elevating the head, this would help with the gravity. Um, this will work with gravity to keep the stomach contents down in your stomach, okay? So it'll prevent the acid from traveling upwards and keep the contents of your stomach down so you're less likely to experience heartburn or acid reflux. Okay, it will help. So I hope you're enjoying this so far. If you haven't done so, head on to your app store and download the app Acuitii and start learning. Let's continue. Yes, I will never give up. Let's see, what was our total score? We can check our total score. So let's see if we go to the leaderboard. So just go to the a picture of your, let's go back to the home page so we can see what our score is against others. So first we have to go to the medal icon at the bottom of the home screen. And I'm not leading at all. I'm at the bottom, I'm sure. Where am I? I'm number 6. Okay, so I've been playing different games, so my total points so far is 7,150 points. Okay, okay, I'm coming up. So I hope you enjoyed this experience. So I invite you to join us again next week as we explore another feature of the Acuitii app. Thank you.